Shows that there is a teenage mental health crisis happening like all over the country.
And experts add the pandemic has made it worse, especially those who are already anxious and depressed.
Chris Riva looked into it, and he's going to introduce us to a local company doing something about it.
Behavioral health is something that school districts here in the tri-state have been addressing, like math, science, and other curriculum. In fact, one local superintendent telling me it's a way to teach the whole child. That's why many schools are partnering with a local company called Terrace Metrics to create a new test to help understand each student's mental health. For some, it helps them reach their full potential, but for others, it stops them from doing self-harm before it's too late. At Deer Park High School, it's testing day.
We give it to students in grades 6 through 12 twice a year.
This test is not an academic one, but an
assessment to students. It is, on one hand, a suicide risk assessment, and it helps identify students that may be at risk for self-harm, but it also gives us those positive indicators.
15 to 20 minutes twice a year, simply to check in, to learn the many types of challenges in these students' lives.
What are some of the challenges that you're identifying?
Ostracism, bullying, depression, at risk of self-harm are really some of the big ones that we see pop up whenever we do some of the assessments.
The test is designed to quickly and accurately identify each child's behavioral health. It's from a local company called Terrace Metrics. It helps a school be proactive instead of reactive. And that's something Dave Conover is thankful for. His child has been flagged for depression and anxiety twice.
Well, those are pretty alarming words, yes. Yeah, I don't think any parent wants to deal with that. But it's reassuring that you get that news from the school, and it allows you to take action sooner than I think you would without it.
Would you have known any other way if it wasn't for this testing through the school?
From a parent's perspective, I don't think so, because I think from a parent's perspective, you don't want to believe there's anything going on, and you don't want to admit there's anything going on with your children because your children are perfect.
Deer Park schools have used the assessment for 3 years now. Campbell County Schools in Northern Kentucky was the first district to locally use Terrace Metrics.
You know, we can't teach them to read, we can't teach them to do math if they are in a bad place emotionally or mentally, and so the school well-being piece of things is an integral part in the puzzle that makes up a student.
Connie Polgears is the director of school improvement for Campbell County Schools.
This gives us a lot of insight into our students that we may not otherwise have. It does help us to identify students that are at risk for self-harm, suicidal ideation, depression, anxiety, all of those risk factors. But it also gives us very invaluable information about their resiliency factors.
In 2018, Dr. Rich Gilman spent 6 months studying school districts, learning there was not a uniform way to identify kids that are struggling. The design of this test is to be proactive, not reactive.
That's how schools have traditionally been using a model such as that. They're waiting for a problem to occur. But what the data shows is that the time it takes between a problem that first emerges to when it is actually brought to a school's attention is a decade. And that means that many students are struggling in silence.
Something Dave Conover says is no longer happening to his daughter.
Are you thankful?
Absolutely. 100%. It allows us to reach out and get her that help and support that she needs, that we wouldn't necessarily know that we needed to get her that.
Dave finishing the conversation saying it's not fair for any child to go through depression or anxiety without help. Terrace Metrics says each test costs less than $20 per student, and many school districts are using grants to fund the entire program. Guys?
I saw a story the other day that said that, the government gave schools so much money during the COVID pandemic, and only like 6% or something, don't quote me on this, was used up. So there's so much money out there, so you would think that they could maybe buy into something like that, maybe perhaps, request it at your school district.
Well, and I think a lot of times adults' tendency is if a child says they have depression or anxiety, you think like, what are you depressed and nervous about, right?
Yeah,
you don't take it seriously, so I'm glad they're taking it seriously.
And kids are busy. I mean, they're busy from the time they get up to the time they go to bed, and plus, and when they're not doing something or studying or something like that, they're here.
Yeah, and they're much busier than when you and I were coming up.
Oh, yeah, absolutely. That's a good story.